Jambo Tito.
Jambo sana, Dr. Stephanie. Bonjour.
Bonjour.
Comment ça va?
Ça va bien, merci.
Wow. So working among refugees from different countries made us to know how to greet in different languages. Doctor, nice to have you again.
Thank you. It's
Yeah,
wonderful.
in our last conversation, you were explaining to us the immune system. So I would like to ask you now, how can we look after our immune system? How can we boost our immune system? Because the only tool that we may have in our body to fight all these viruses.
So the immune system is really all that we have. And
Yes.
we need to supplement it, we need to strengthen it and support it to be able to effectively fight viruses. The most effective way of
Yes.
supporting our immune system is through our lifestyle. So what we eat, what we drink, how much we sleep, and how much stress we have in our lives. So you may ask me, well, what has that got to do with the immune system? If our bodies are stressed, our body actually shuts down the immune system because our body thinks it's fighting something very, very scary.
Yeah.
Okay, so for example, if you are, if a lion is chasing you, your body is going to take all your blood and all the energy away from the immune system and put it into your muscles so that you can run away. When we are under stress, our body says, we don't have to fight infection, we need to get away. That's what the body is doing. So the first thing to say is, COVID is very stressful. It really is a stressful time. And so that's actually not helping our immune system. So the first thing we need to do to support our immune system is to get into a place of rest. For some people, it's about praying, reading the Bible, being with your community. Breathing is very important. If you breathe in and you don't breathe out enough, then your body thinks it's running away from something again. So just by building breathing into your day, just so that the out breath is longer than the in breath. I mean, that's a simple thing, right? But that actually helps your immune system to get stronger.
So now you mean that all these different informations that we accumulate that cause fear in us, it's a harm to our immune system.
That's exactly right. So one of the key things that you can do to support your immune system is only watch the news once a day or every second day, and actually spend more time thinking about things that are going to be pleasurable, that give you joy, because that actually boosts your immune system.
So we need enough time to relax,
Correct.
you
And
know,
sleep
and rest.
talk and laugh. Those things really, they switch off your what's called the fight-flight response, which is that stress response, and it turns on the rest and digest response, which is where we can really fight infection. So that's the first thing, manage those three things.
Okay.
Second thing is, what are we eating? Now, everyone thinks what you're eating is about, are you fat or thin, or have you got energy or no energy? But actually, the food that we eat is the building blocks for our immune system. So our immune system cannot function without the stuff that we get from our food.
I see.
If you remember in our last session, we spoke about the barrier that our body has, like an
Yeah.
electric fence. Do you remember we spoke
I
about that?
still remember, yes.
Okay. So that electric fence has a negative charge. Our nose, our mouth, our gut has a negative electrical charge. And a virus has a negative electrical
also,
charge.
yeah.
Right. But if we don't eat enough sulfur in our diet, then that negative charge turns positive, meaning we become a magnet for that virus.
Yeah, positive and negative.
positive.
They
Whoops,
immediately,
there you
yes.
go.
Yeah, I understand.
So you can see how part of our immune system is actually determined by what we eat. So you can ask me, where do I get sulfur from in my
Yeah,
diet?
that's actually what I was going to ask you. Tell us about what to eat and what to avoid.
Great.
Those two.
Okay, so if you want to make that negative charge really consistent, you need to eat sulfur. Where do you find sulfur? You find it in simple things like eggs. You know that smell of the egg when you've boiled that egg and it smells a bit funny? That is the smell of sulfur.
Wow.
So sulfur, spinach, mfino, kale, broccoli, all of those things have got so much sulfur in them. So if we are eating those things every day, that coronavirus will come and sit in your nose, and it can sit there for the next 100 years. It won't get into your body because you've got enough sulfur, you've made a negative charge, and every time that virus wants to come in, it's just getting repelled. How simple is that? Then there are 3 or 4 things that we must have in our diet to be able to help that immune system work properly.
Okay.
The first thing is vitamin D. Many people don't know about vitamin D. But vitamin D is like the ammunition in the immune cells, and it's almost like a conductor of an orchestra.
Wow.
So if you are having an orchestra and there's no conductor, then those instruments are all playing what they want to play. There's no coordination.
I used to hear people saying you get vitamin D early in the morning when sunrise.
Correct.
Yeah.
Okay, so vitamin D in some ways is free because you can just go outside and get some sun, and then the sun comes into your skin and it turns on your vitamin D. But you can also get it in your food, so also eggs and dairy and fish all contain vitamin D, and actually you can get it in a vitamin form because most people are deficient in vitamin D. Yes. So now during COVID time, I would suggest if you can, get a vitamin D supplement. Okay, second thing that's really important is vitamin C. Can we all hear vitamin C?
Yeah, always when flu, they advise people to get vitamin C through different fruits. Yeah.
Correct. Okay, so again, when you've got an infection or when you're preparing for an infection, you must have enough of it in your body. Most people don't take enough vitamin C. People think I'll just take 1 a day, that's enough. Actually, if you are infected, even mildly infected, you can take 1,000 milligrams, which is one of those big lozenges. You can take that every 3-4 hours. And when you're very sick, you should take it even every hour. Number 1, it stimulates your adrenal system, so fighting those things. But it also it's an antioxidant, so it clears up all of the rubbish that's happening. When there's a fight going on in your body, there's a lot of toxins, dead virus and chemicals and all sorts of things in your body.
The vitamin C.
And the vitamin C helps to neutralize that and to give your body nitrous oxide, which it needs to be able to fight the virus. So that's the second thing.
Vitamin D, vitamin C.
Right, okay. And remember the sulfate.
Yeah.
The sulfur. Okay. I think the next important thing is to make sure that the linings of your lungs are supported. So that's where vitamin A comes in. That's an oil, and you know that all of our linings are made up of oils.
Yes.
You may or may not know that, but it's very important that vitamin A is in your body.
Where do we get this vitamin A?
Okay, so vitamin A is so easy to get. It's all your orange vegetables, so butternut, pumpkin, carrot, they're full of vitamin A. But the best place is your liver. So chicken livers, beef livers, that's very full of vitamin A. Easy.
Wonderful.
You can also get it from the health store in a tablet form, but I think it's good to just eat your vitamin A.
This is wonderful. All the solutions are around us.
And then the final one, which is where all the controversy comes in, is something called zinc. Okay.
Yeah, I heard about zinc. All over zinc in Madagascar, in our organic food. How does zinc help, and why people are talking about zinc?
Okay, zinc is a really, really cool mineral. It's a mineral, it's like salt, okay?
Yes.
And again, we don't get enough of it in our diet because it's in your green leafy vegetables. So we don't eat enough green leafy vegetables, especially children, and we don't eat. So we don't have enough of it in our diet. But what it does in our immune system is it actually helps to deactivate the virus. And it calls also other immune cells to come and kill the virus. It's a very powerful mineral. The problem is, number 1, we don't have enough of it. And secondly, it needs to be pulled into the cell. So if we take it and we eat it, it can be in the fluid, in the blood, but it needs to be pulled into the cell in order to kill that virus. So there is a thing called a zinc ionophore. It's a big word.
But zinc ionophore.
Good. And all that a zinc ionophore does is it looks for the zinc. When it sees it in the blood, it pulls it into the cell so that we've got more zinc in the cell so that it can kill the virus. And guess what is the zinc ionophore? Hydroxychloroquine. You know, the thing that they're talking about everywhere.
So that's why they are talking about it.
Yes. So hydroxychloroquine.
Most of people from like Central Africa, East Africa, because there's a lot of malaria, we used to use those
All right.
chloroquines. Yeah.
So hydroxychloroquine works directly on malaria, on the malaria organism. But in the case of COVID, it doesn't work directly on COVID. What it does is it pulls zinc into the cell so that zinc can kill the virus. Okay.
I see.
So hydroxychloroquine is one zinc ionophore, but we have another one in Africa.
But does hydroxychloroquine has zinc in it?
No.
So if you take it without taking zinc, it's useless.
Correct. So we need to take hydroxychloroquine with enough zinc. So either zinc in a supplement form or to have enough of it in our diet. But there's other different zinc ionophores. So if you can't get hydroxychloroquine, then we've got some other ones in Africa that we can use. We can get wormwood, Artemisia. You can get it in a tincture form, you can get it in a supplement, you can get it in your garden.
But doctor, I would like you to tell us about what destroy our immune system. What can we avoid to destroy our immune system?
Sure. Yeah, that's a great question, and I think it's especially an interesting question for the people who are vulnerable. So we already have people who have got vulnerable immune systems. So your old, elderly people, they have vulnerable immune systems just because they're older.
I understand.
You know, you also have people with diabetes, you've got people with high blood pressure, you've got people with immune-compromised HIV. So they've already got a compromised immune system. So for them, it's very, very important to build on what we already spoke about, the good foods. But then I think it's really important to avoid food that is going to inflame your body. Okay, so I think many people have heard of inflammatory foods.
Yes.
That when you eat them, your body doesn't like it because it's got preservatives and it's got toxins and it's got colors and it's got all sorts of things that actually the body sees as foreign. Just like a virus is foreign, sometimes the food that we eat is foreign. And so the body is going to spend time trying to clear that out instead of keeping itself strong.
Yeah.
So we're talking about foods that are very processed, like chips, sweets, even very refined foods such as refined maize, for example. You know, maize is a staple in people's diets, but it's actually not very good for us. It's an inflammatory food. So with those kinds of foods, we want to replace it with whole foods, with cassava or with
I'll go back to our roots,
basics,
organic basics, organic food.
Sorghum, some of the original grains, which some people might say that's expensive, but actually it's not difficult to find mabela or sorghum porridge and replace that instead of having your maize. Then things like drinks that are full of Coke. People love all of those things, even iced teas, even some drinks that say this is a health drink. Actually, when you look a little bit,
so we must start.
You must read your labels.
Yes, and have our homemade juice. Mix fruits.
Water.
Yeah.
Drink lots and lots of water. Rooibos tea is a very good thing to drink. One wants to also avoid dairy, especially if you're starting to feel like you've got flu symptoms. Because that can create mucus in your nose or your throat, so that's not very good for you. So mostly what we're wanting to avoid is the inflammatory foods, the processed foods. So anything that had to go through a factory to get made, sausages, polonies, things we love those things, but actually it's not good for us. So this is the time, I think, in COVID for us to go back to what our grandparents ate.
Yeah, this is wonderful. We have enough in Africa to enjoy. Yeah, cassava, isombe, is known everywhere in African countries. So we need to go back to that. Wow, doctor, can you tell us about smoking and taking alcohol? Is it also?
I will go as far to say that anything that's toxic should not be in your body during COVID season.
You said it.
Okay, so Tito, I think that's the basics of the immune system, and if we can be breathing, moving, exercising, keeping our stress levels down, eating lots of good green vegetables that are simple to grow in the garden, we're going to be doing a good job for our immune system, and we will really reduce our chances of getting COVID. And if we do get COVID, we will increase our chances of being able to fight COVID within a normal period
simple.
of time. Yeah.
Let's buy oranges. Let's have veg in our gardens. Use whatever they have in their reach, to boost their immune system. Thank you.
Such a pleasure. Thank you.
African solution for Africa.